Now let's first define what the term compensation means. This is the correction of an organic defect by excessive development or by increased functioning of another organ. We've discussed how both the respiratory and renal system tries to regulate the pH, but it's important to know that the respiratory system compensates quickly, really within a matter of minutes, and called the respiratory compensation, and the renal system takes hours to compensate, so it starts off a little later, and this is known as the metabolic compensation. So if there is an acidic disbalance, the metabolic compensation would be to release more hydrogen ions and retain bicarbonate ions. Now, using the equilibrium equation, let me help make sense of this. Decrease in bicarbs will result in a metabolic acidosis, and to compensate, the partial pressure of carbon dioxide will decrease to move the equation into this direction to try and compensate for it. In the case bicarb is high, this results in a metabolic alkalosis, and the compensation would be to increase the carbon dioxide to drive the equation in the opposite direction to counter it. And in the same way, the increased partial pressure of carbon dioxide, which is seen in respiratory acidosis, the compensation would be to increase the bicarb and drive the equilibrium that way. And in respiratory alkalosis, where the carbon dioxide is decreased, the compensation would be to decrease the bicarb level. Now, how can we differentiate the cause and compensation? This is easy to figure out when you are given an ABG report and you look at the values. Let's go through an example, since this is the best way to learn acid-base problems. Now we have a case where we have the pH is 7.25, the bicarb is low, and so is the carbon dioxide. What is the acid-base disorder? Since it is acidosis from the pH, we then look at the next two values. The bicarbonate level is low, and so is the carbon dioxide. Now, from what we've learned previously, which of these will drive the equation to produce more hydrogen ions? Yes, it's the low concentration of bicarbs. So this is a metabolic acidosis, and since the carbon dioxide is trying to drive the equation in this direction, it is low, and therefore this is a respiratory compensation. So this is an example of a metabolic acidosis with respiratory compensation. Now, compensatory changes are very important when it comes to your exams, especially for the boards. So it's important to understand how each occurs. Respiratory compensation. Now, the two ways in which the body tries to compensate through respiratory system is hyperventilation and hypoventilation. When a person hyperventilates, they blow off the carbon dioxide, causing for the partial pressure of carbon dioxide levels to fall, which results in less hydrogen ions, which causes for the pH to rise. When a person hypoventilates, they basically do the opposite and retain more carbon dioxide, causing for a rise in plasma carbon dioxide levels and more hydrogen ions in the blood, causing for a fall in the pH. In renal compensation, this is slightly different. For acidosis, first, the excess hydrogen ions are secreted into the nephrons, and then two important changes occur. Bicarb ions are reabsorbed, and as for the hydrogen ions, urinary buffers are excreted that bind to the hydrogen ions, such as phosphate and ammonia, which are excreted as phosphate and ammonium. These buffers are important because without them, there will be severe drops in the pH that would be extremely damaging to the kidneys. In alkalosis, the opposite occurs. Bicarb ions are excreted and urinary buffers are reabsorbed. There can also be mixed disorders where two disorders occur at the same time. So in order to see whether there is a mixed disorder, we determine the expected response. And these are done by the renal formulas that help. First, for metabolic acidosis, we have the Winter's formula. In the setting of metabolic acidosis only, in order to blow off carbon dioxide, the body will hyperventilate, and the Winter's formula tells you the partial pressure of carbon dioxide to expect. And if the actual partial pressure of carbon dioxide is not equal to the expected levels, you can expect a mixed disorder. So the formula is the partial pressure of carbon dioxide is equal to 1.5 multiplied by the bicarb level plus 8 plus minus 2. Now for example, we have a pH of 7.2, a bicarb level of 9 millicurie per liter, and carbon dioxide of 22 millimeters per mercury. When we calculate it, it is 1.5 multiplied by 9 plus 8. So that's 22 plus minus 2. So this is the expected, and no mixed disorder has occurred, since the partial pressure of carbon dioxide was also 22. Now another example in which the pH is 7.2 and the bicarb level is 12 and the carbon dioxide is 40 millimeters mercury. And the expected carbon dioxide level will be 1.5 multiplied by 12 plus 8, which is 26 plus minus 2. Now see, the partial pressure of carbon dioxide is too high, so there is a concomitant respiratory acidosis. But you can argue that the partial pressure of carbon dioxide was 40. That's normal. But you have to remember that the respiratory compensation is very quick. And if that is normal, there is something definitely wrong, since there is a metabolic disorder. The partial pressure of carbon dioxide is never normal. It is always going to be less in order to equalize the formula. Now I have to stress again that the Winters formula that calculates the expected carbon dioxide in metabolic acidosis is extremely important, and you do get tested on this formula frequently in exams. Now coming to metabolic alkalosis, in this case, the main aim is to increase the carbon dioxide to counter the metabolic alkalosis. In this, the person hypoventilates. And if the actual carbon dioxide level is not equal the expected level, then we have a mixed disorder. So the formula for this is a change in the partial pressure of carbon dioxide is equal to 0.7 multiplied by the change in bicarb level. So let's look at an example. If the pH is 7.48 and the bicarb level is 34 and the carbon dioxide is 47, the change in bicarb is 10. Since 34 minus 24 is 10 if we take 24 as a normal value. So the expected carbon dioxide change is 0.7 multiplied by 10, which is 7. And if we look at the actual carbon dioxide change, which is 47 minus 40, is equal to 7. So there is no secondary disorder. In respiratory acidosis, compensation can either be acute or chronic. And there are different formulas used, but because these are not so high yield for a medical student to know, we're not really going to mention them in this video and only keep the things that you really do have to know. But as a general rule, acute compensation for respiratory acidosis, there is going to be a 1 millicurie per liter increase in bicarb for every 10 millimeter mercury increase in carbon dioxide. And in chronic compensation, there's going to be 3.5 millicurie per liter increase in bicarb level for every 10 millimeter mercury increase in partial pressure of carbon dioxide. For respiratory alkalosis, there's also acute and chronic compensations. For acute compensation, there's a 2 millicurie per liter fall in bicarb level for every 10 millimeter mercury drop in carbon dioxide. And for chronic compensation, there is a 4 millicurie per liter fall in bicarbs for every 10 millimeter mercury fall in carbon dioxide. Compensation time frame is something that you really have to keep in mind.